Welcome back for some extra education and learning about the receptors of the autonomic nervous system. Think of your body as a big city with different areas. These adrenergic receptors are like little spots in this city where messengers called adrenaline or epinephrine can go and deliver messages. The alpha receptors are in different parts of your body. They are in your blood vessels, where they can tighten things up when they get a message. It's like when there's construction on a road and they put up barriers to narrow the way. These alpha receptors help control things like blood pressure. Now let's find out about the beta receptors. They're like switches in your heart and lungs. When adrenaline hits these spots, it's like turning up the dial on your heart rate and opening up your airways, helping you breathe better and getting more blood pumping. So, alphas tighten things up like squeezing a tube, and betas speed things up like revving an engine. They're both important in how your body handles stress and keeps things working right. Let's break this down a bit more. Alpha adrenergic receptors. Alpha receptors are found in various tissues like blood vessels, the eyes, and certain organs like the prostate gland. There are different types of alpha receptors. We will focus on alpha 1 and alpha 2. Alpha 1 receptors found in blood vessels when activated cause the blood vessels to constrict. Alpha 2 receptors, when stimulated, can have various effects, including regulating the release of certain hormones like insulin. Beta adrenergic receptors. Beta receptors are primarily found in the heart, lungs, liver, and certain blood vessels. There are also different types of beta receptors. We will focus on the beta 1 and beta 2 receptors. Beta 1 receptors in the heart, when activated, increase heart rate and the force of contraction, boosting the heart's pumping action. Beta 2 receptors are mostly in the lungs, and when triggered, they relax the airway muscles, making breathing easier. When stress or excitement triggers the release of adrenaline or epinephrine, a stress hormone, into the bloodstream, it travels and binds to these alpha and beta receptors. So in a nutshell, these receptors play a crucial role in the body's response to stress by regulating heart rate, blood pressure, and breathing. Their activation helps the body cope with immediate demands, preparing it to handle challenging situations. Next, we will dive into the parasympathetic system. Imagine your body as a big communications network. Cholinergic receptors are like phone receivers that respond to a specific messenger called acetylcholine, sort of like receiving a phone call. Cholinergic receptors. These receptors are spread throughout the body in places like muscles, glands, and the brain. Muscarinic receptors. They're a specific type of cholinergic receptor found in places like the heart, lungs, smooth muscles, and glands. These receptors work a bit like switches for various bodily functions when acetylcholine comes calling. When acetylcholine, the messenger, interacts with muscarinic receptors, it triggers specific responses in different parts of the body. Here's a more in-depth look at muscarinic receptors in the heart. Activation of muscarinic receptors in the heart can slow down the heart rate, which can help calm down the body's responses. Muscarinic receptors in the heart are a specific subtype of receptors that respond to the neurotransmitter acetylcholine. Muscarinic receptors are primarily located in the sinoatrial node, SA node, atrioventricular node, AV node, and atrial muscle cells of the heart. The SA node is the heart's natural pacemaker. Activation of muscarinic receptors in the SA node slows down the firing rate of electrical impulses, reducing the heart rate. This is known as negative chronotropy. It's like pressing the brake pedal on the heart's rhythm, slowing it down. AV node. Muscarinic receptor activation in the AV node slows down the conduction of electrical signals between the atria and ventricles. This delay is beneficial as it allows the atria to complete their contraction before the ventricles contract. This delay is called AV nodal delay. Atrial muscle cells. Muscarinic receptors in the atrial muscle cells can cause a slight decrease in the force of contraction, known as negative inotropy. This effect contributes to the overall decrease in the heart's pumping strength. Understanding the role of muscarinic receptors in the heart helps in comprehending the intricate control mechanisms that regulate heart function and the balance between the sympathetic, fight or flight, and parasympathetic, rest and digest, nervous systems. Now let's get a little deeper into the lungs. Muscarinic receptors in the lungs play a crucial role in regulating the smooth muscle tone of the airways and influencing various respiratory functions. Location. Muscarinic receptors are present on smooth muscle cells surrounding the bronchi and bronchioles, which are the smaller air passages in the lungs. When these receptors are activated by acetylcholine, several effects occur in the lungs. Bronchoconstriction. Activation of muscarinic receptors causes the smooth muscle around the airways to contract. This narrowing of the air passages is known as bronchoconstriction. It leads to a decrease in the diameter of the airways, making it harder for air to move in and out of the lungs. Think of it as squeezing a straw. Less air can pass through when it's narrowed. Muscarinic receptor activation also stimulates the production of mucus in the airways. This mucus can help trap and clear away foreign particles or irritants, but when excessive, can contribute to airway blockage or coughing. In conditions like asthma or chronic obstructive pulmonary disease, COPD, there can be an increased sensitivity or overactivity of muscarinic receptors in the airways. This leads to excessive bronchoconstriction and mucus production, causing symptoms like coughing, wheezing, and shortness of breath. Pharmaceuticals known as anticholinergics or antimuscarinics work by blocking these muscarinic receptors in the lungs. This blockade prevents acetylcholine from binding to the receptors, thereby reducing bronchoconstriction and decreasing mucus production, which helps to alleviate symptoms and improve airflow in conditions like asthma or COPD. Understanding the role of muscarinic receptors in the lungs sheds light on how these receptors influence airway constriction and mucus production, and how medications can target these receptors to manage respiratory conditions. I hope the provided information helps you understand more about the sympathetic and parasympathetic systems as you continue on your educational journey. Please like and subscribe for more content like this.